Introduction. Welcome to today's lecture on medical nanotechnology and the management of glaucoma. Glaucoma is a complex, chronic eye disease characterized by progressive optic nerve damage and visual field loss. It is the leading cause of irreversible blindness worldwide. In recent years, advancements in nanotechnology have opened up new possibilities for the early detection, treatment, and prevention of glaucoma. This lecture will provide a comprehensive overview of the various applications of nanotechnology in glaucoma management, including the use of nanoparticles for intraocular pressure, IOP, reduction, ocular drug delivery, neuroprotection, optic nerve regeneration, glaucoma detection and monitoring through nanosensors, imaging techniques, nanotheranostics for personalized management, nanoscale drug formulations, and the safety and ethical considerations associated with nanomedicine. Without further ado, let's delve into the details of this fascinating field. Glaucoma is a group of eye diseases that damage the optic nerve, leading to vision loss. The primary risk factor for glaucoma is elevated intraocular pressure, IOP. Normally, the aqueous humor, a fluid that nourishes the eye, flows in and out of the eye to maintain a healthy IOP. However, in glaucoma, the drainage system becomes compromised, resulting in increased IOP, which in turn damages the optic nerve. The understanding of the pathophysiological mechanisms underlying glaucoma has paved the way for the development of various nanotechnology-based solutions aimed at reducing IOP and preventing vision loss. Nanotechnology involves the design, characterization, and application of materials and devices at the nanoscale level, 1 to 100 nanometers. At this scale, nanomaterials exhibit unique physical, chemical, and biological properties that make them particularly well suited for medical applications. Various nanomaterials, such as nanoparticles, nanofibers, and nanotubes, can be engineered to interact with biological systems in a targeted and controlled manner. Advances in nanotechnology have revolutionized the field of medicine, enabling precise drug delivery, enhanced diagnostic imaging, and tissue regeneration. In the context of glaucoma, nanotechnology offers tremendous potential for addressing the complex challenges associated with the disease. Reducing elevated IOP is one of the primary goals in the management of glaucoma. Traditional treatments, such as eye drops and oral medications, often have limitations, including poor bioavailability and systemic side effects. Nanoparticles have emerged as a promising approach for localized drug delivery to the eye, offering improved therapeutic efficacy and reduced systemic toxicity. These nanoparticles can be engineered to encapsulate anti-glaucoma drugs and release them in a controlled and sustained manner, enhancing drug bioavailability and reducing the frequency of administration. Through the development of biocompatible and biodegradable nanoparticles, researchers are working towards safer and more effective strategies for IOP reduction in glaucoma patients. Effective drug delivery to the eye presents numerous challenges due to the complex ocular barriers and rapid clearance mechanisms. Nanotechnology-based ocular drug delivery systems have the potential to overcome these barriers and improve the therapeutic outcomes for glaucoma patients. Various approaches, such as nanosuspensions, nanoparticles, and nanoemulsions, can enhance ocular drug retention, penetration, and sustained release. Additionally, the incorporation of targeting ligands on the surface of nanoparticles allows for specific delivery to the desired ocular tissues, optimizing drug distribution and minimizing side effects. The development of these innovative drug delivery systems holds great promise for improving treatment outcomes in glaucoma. Neuroprotection, the preservation of retinal ganglion cells, RGCs, and their axons, is a key therapeutic strategy in glaucoma management. Nanoparticles can play a crucial role in neuroprotection by delivering neuroprotective agents directly to the affected tissues. Various nanomaterials, such as gold nanoparticles and mesoporous silica nanoparticles, have been investigated for their potential to enhance RGC survival and function. These nanoparticles can carry neuroprotective agents, such as antioxidants and growth factors, to the site of injury, providing targeted therapy for neurodegeneration. Additionally, nanotechnology can be utilized to deliver small interfering RNA, siRNA, or gene therapy vectors, promoting the expression of protective genes and RGCs. The integration of nanotechnology into neuroprotective strategies holds great promise for slowing down the progression of glaucoma. The regeneration of damaged optic nerves presents a significant challenge in glaucoma management. Nanotechnology-based approaches offer new avenues for promoting optic nerve regeneration and restoration of visual function. Nanomaterials, such as nanofibers and nanospheres, can serve as scaffolds for supporting and guiding the growth of regenerating nerve fibers. These scaffolds can be engineered to release growth factors and provide structural support, promoting axonal regeneration. Nanotechnology also enables the delivery of stem cells or progenitor cells directly to the site of optic nerve injury, enhancing tissue repair and functional recovery. The integration of nanotechnology into optic nerve regeneration strategies offers exciting possibilities for restoring vision in glaucoma patients. Early detection and continuous monitoring of glaucoma progression are crucial for timely intervention and effective management. Nanosensors hold great potential in revolutionizing glaucoma diagnosis and monitoring by enabling non-invasive, real-time analysis of biomarkers associated with the disease. These nanosensors can detect subtle changes in IOP, ocular blood flow, and biomolecular markers in tears or aqueous humor, providing valuable information on disease progression. Nanotechnology-based sensing platforms, such as plasmonic sensors and carbon nanotube-based sensors, offer high sensitivity, specificity, and selectivity. The integration of nanosensors into wearable devices or implantable systems opens up new possibilities for personalized glaucoma management. Accurate imaging techniques are essential for early detection, monitoring, and management of glaucoma. Nanotechnology has played a pivotal role in the development of advanced imaging modalities for glaucoma. Nanoparticles, such as quantum dots and iron oxide nanoparticles, can be engineered to serve as contrast agents for enhanced imaging of ocular structures. These nanoparticles can be targeted to specific cells or tissues, providing precise and detailed visualization. Additionally, nanotechnology enables the integration of imaging probes with therapeutics, facilitating theranostics, a combination of therapy and diagnostics. This integration allows for real-time monitoring of therapeutic responses and individualized treatment strategies in glaucoma patients. Nanotheranostics, the integration of therapeutic and diagnostic functions into a single nanoplatform, holds great promise for personalized glaucoma management. Nanotheranostic systems offer simultaneous imaging and targeted therapy, enabling real-time monitoring of treatment efficacy and personalized adjustment of therapeutic strategies. These nanotheranostic platforms can be designed to deliver therapeutic agents directly to the affected tissues, while imaging modules enable the visualization and quantification of disease progression. By tailoring treatment strategies based on individual patient characteristics and therapeutic responses, nanotheranostics offer the potential for improved treatment outcomes in glaucoma. Combination therapy, which involves the simultaneous administration of multiple drugs, has gained significant attention in glaucoma management. However, the development of effective combination therapies faces challenges related to drug compatibility, bioavailability, and dosing regimens. Nanoscale drug formulations provide an innovative solution for enhancing the therapeutic outcomes of combination therapy in glaucoma. Through nanotechnology, drugs with different mechanisms of action can be encapsulated within a single nanoparticle, allowing for precise control over drug release kinetics and synergistic effects. These nanoscale drug formulations can improve drug stability, bioavailability, and therapeutic efficacy, thereby enhancing the effectiveness of combination therapy in glaucoma patients. As with any medical intervention, the safety and regulatory considerations associated with nanomedicine in glaucoma management are of utmost importance. Nanomaterials may exhibit unique properties that could potentially pose risks to human health and the environment. Therefore, rigorous safety assessments and regulatory frameworks are essential to ensure the safe development and clinical translation of nanotechnology-based interventions. It is crucial to evaluate the biocompatibility, biodegradability, and potential toxicity of nanomaterials, as well as their long-term effects on ocular tissues and systemic distribution. Additionally, regulatory agencies play a crucial role in overseeing the approval and commercialization of nanomedicine products, ensuring their safety, efficacy, and compliance with established standards. The rapid advancements in nanotechnology raise important ethical and societal implications, which must be carefully addressed in glaucoma management. Ethical considerations include issues related to patient autonomy, informed consent, privacy, and equity of access to nanomedicine-based interventions. Socioeconomic factors can also influence the implementation and affordability of nanomedicine in glaucoma care. Furthermore, the potential for nanotechnology to widen the gap between developed and developing countries must be examined. It is essential that stakeholders, including healthcare professionals, policymakers, and the general public, engage in proactive discussions to ensure the responsible development and equitable distribution of nanomedicine in glaucoma management. In conclusion, nanotechnology holds tremendous potential in the management of glaucoma. The applications of nanotechnology in glaucoma range from IOP reduction and ocular drug delivery to neuroprotection, optic nerve regeneration, glaucoma detection and monitoring, imaging, nanotheranostics, combination therapy, and safety considerations. The integration of nanotechnology into glaucoma management strategies offers personalized solutions, enhanced therapeutic outcomes, and improved patient care. However, it is crucial to address the ethical, safety, and regulatory aspects associated with nanomedicine to ensure the responsible and equitable implementation of these innovative approaches. As we continue to explore the exciting possibilities of nanotechnology, it is hoped that these advancements will revolutionize glaucoma care, ultimately leading to better outcomes and an improved quality of life for patients.